What role do genes play in prostate cancer risk? Imagine your genes as a set of instructions that influence many parts of your health, including your risk for prostate cancer. Scientific research shows that genetics can account for roughly 57 to 60% of prostate cancer risk, highlighting how much heredity matters. This means that your inherited genetic makeup can significantly influence whether you develop prostate cancer over your lifetime. Family history is one of the clearest indicators of genetic risk. Men whose fathers or brothers have had prostate cancer are more than twice as likely to develop it themselves. The risk climbs even higher if multiple relatives are affected or if they were diagnosed at a younger age. This pattern suggests that certain inherited genes make some families more susceptible to prostate cancer. Certain gene mutations are linked to a higher risk of developing prostate cancer. For example, mutations in the genes called BRCA1 and BRCA2, which are also associated with breast and ovarian cancers, can increase prostate cancer risk. Men with BRCA2 mutations tend to develop more aggressive forms of the disease. Another gene called HOXP13 has also been linked to increased risk, especially in families with early-onset prostate cancer. These genes are involved in repairing DNA damage, and when they are mutated, cells can grow uncontrollably, leading to cancer. Hereditary prostate cancer, which runs in families, makes up about 5 to 10% of all cases. Men with this type often face earlier diagnosis and more aggressive tumors. Because of this, understanding your family history can help determine if you might benefit from earlier or more frequent screening. Advances in genetic testing have identified over 170 genetic markers associated with prostate cancer risk. These markers help create risk scores that can predict who might be more likely to develop the disease. Such information can guide personalized screening plans, allowing for earlier detection when treatment is most effective. It is also important to recognize that genetics interact with other factors like race and healthcare access. Some genetic variants are more common in certain populations, which partly explains differences in prostate cancer rates among different groups. For example, men of African descent tend to have higher risk, partly due to genetic and socioeconomic factors. Knowing your genetic risk can be very helpful. Men with high-risk gene mutations or a strong family history might consider starting prostate-specific antigen testing earlier or having more frequent checkups. This proactive approach can help catch cancer early when it is most treatable. In summary, genes play a vital role in determining prostate cancer risk through inherited mutations and common genetic variations. Understanding these factors can help identify men at higher risk and support tailored screening and prevention strategies. However, genetics are just one piece of the puzzle, as environmental and lifestyle factors also influence risk. If you are concerned about your genetic background, it is best to consult healthcare professionals who can provide personalized advice and appropriate genetic counseling.